So my name is Clare Bailey. I'm a consultant ophthalmologist at Bristol Eye Hospital, specialising in retinal disorders, and I'm clinical lead of our clinical research unit. When I became a consultant back in 2001, there were no effective treatments for wet macular degeneration when the fluid had involved the centre of the retina. So all we could say to patients at that stage was, I'm afraid we don't have any treatment. We'd explain what the diagnosis was, and we'd say, well, you are going to lose your central vision, and we give them as much support as possible. The impact could be very profound because you would typically expect in an eye or eyes involved that the central vision would be lost to a very significant extent. So if that was affecting both eyes, people might not be able to, they certainly wouldn't be able to read, potentially not recognise faces. They might not recognise their grandchildren. They might not be able to live at home on their own anymore because they couldn't manage the activities of daily living. It was very, very profound impact. And many, many people were registered as partially sighted or blind as a result of this condition. Over the years, there have been considerable research efforts to try and improve that situation. And since about 2007, there has been the first treatment that could help to treat wet macular degeneration in the form of little injections to the eye. Since that time, there have been newer drugs coming out and newer regimes of giving treatment, so the outcomes now are dramatically better than they were before. So whereas patients would be expected to lose pretty much all of their central vision without treatment, now we expect to preserve the vision and indeed in many examples improve the vision considerably. So eye research is extremely important. It's very close to my heart. It is so encouraging to see a dramatic shift in what you're able to offer your patients over the years. To be seeing patients back when I became a consultant in 2001 and say to them, I'm sorry, we don't have a treatment, and then to be involved with lots of clinical research trials, and now we do have a treatment, is extremely encouraging. And it's lovely to be able to push back the boundaries and try and make things better for the future. We're really keen to do as much research as possible because, we really want to champion the visual benefits for our patients for the future. We'd all love to do more research, and we've got lots of interested people who'd be willing and keen to take on more, but actually funding is the major rate limiting step. There's a limited number of grant awarding bodies. Some are charities, some are national grant awarding bodies, and so can be very good research applications that go in that don't get funded, and then it's very hard to take those forward.